Okay, the task force report, it was, I think it was, I can't remember the exact number of pages. It was a long report, and I would say I'm a proponent of that report because there's a quote by Max Dupree that says that the first duty of a leader is to define reality, the last is to say thank you, in between, the leader is a servant. So what this task force report, it puts into perspective the challenges that the healthcare, let's say in Nairobi, for the Nairobi one now in particular, it puts into perspective the challenges that are being faced. It puts into perspective, like right now, Governor Sakaja has all the data of how the number of clinical officers, the number of medical officers, the number of pharmacists, the number of dentists, the number of nurses in the county, and not only the number that are employed, there's, that shortfall. So there were 8 main, basically the report was hinging on 8 main things, but off the cuff I can mention 3. I think the first one was strengthening primary health care. Primary health care through healthcare financing. And on that particular aspect, we need to relook at how we are financing. We need to relook at the amount of money we're putting into our healthcare. Just diverting a bit from the county, you find that Kenya is a signatory to the 2001 Abuja Declaration. But if you look, that recommends that at least 15% of the budget is supposed to be allocated to healthcare. But if you look at the financial year, the current financial year we're in, the amount that has been allocated to healthcare is less than 5%. I think around 4.4% to be exact. And the other thing that the Nairobi County Health Task Force reform was, the recommendations that was giving, it was about improving service delivery. And from, because most of the parts that I looked at was from the pharmacy context, on improving service delivery, we have health products and technologies, because we have, the medicines and all that. The county is going to procure that, but who's going to give out this medicine? So the task force report, from a pharmacy perspective, it recommended that we need the health personnel. So it recommended employment of at least 160 pharmacists to be done almost immediately, and 190 pharmaceutical technologists. So you see, even that way it goes along. If the county employs 160 pharmacists, 190 pharmaceutical technologists, and even other cadres were recommended, it's even going along in solving the crisis our generation is facing post-internship of employment. And then the last, something else that the task force report recommended was, I think it was on giving attention to proper clinical training. You see, Olive was staring at I'd put it as a generational crisis. Me, I'm the firstborn of the Gen Z, and then especially Gen Z are the ones that are affected, and there's, the millennials that were born mainly in the early 90s. Because what used to happen is that after you are done with your medical officer internship, pharmacist internship, dentist internship, you would finish your internship and the government would post you immediately. But this generation, this group of people, especially from around, I think 2017 to be exact, you are just, after finishing internship, you are outside there. And now what is happening is that because there's these opportunities, counties are not employing people. So we're looking at, the number of people going into clinical practice is shrinking, because you know that counties are not employing people, and then when people are not going to clinical practice, again, they're not going to specialize in that. So we can look at, if we don't address this issue urgently, 40 years from now, you won't be having your urologist, because the medical officer didn't go to practice clinically. Maybe there's a term we're using to refer as amorphously. Maybe they went to practice some certain role in the private sector. So, this is something that needs to be addressed very urgently. And as I conclude on that, I want to make a passionate appeal to the powers that be, the minister, the CS for health, the PS for health, that those over 1,000 interns, medical officer interns, pharmacist interns, dentist interns, over 1,000 of them, they have finished their 5 years, their 6 years, and like Dr. Mokera said, 7 years in some instances. You talked about the strike in 2017. Most of these guys were in school. At that time, that strike kept them out for almost 1 year. So someone has been waiting for 7 years, they have graduated, but they're still waiting for a further almost 1 year because the government hasn't posted them. And the requirements of KMPDC and PPB is that it's mandatory for you to do that internship before you can get your license. Like in my case, after I finished my 5 years of pharmacy school and 1 year internship. That's when now I sat for the Pharmacy and Poisons Board Stage 2 exam and got my license, because you can't do anything. So we have over 1,000 of my peers, of my colleagues out there stranded. They can't do anything because they can't apply for a job, because if you go to apply for a job, they'll ask you, where's your KMPDC license? Where's your PPB license? You need to finish your internship. So I'm just making a passionate appeal to the CS for Health, to the PS for Health, and the powers that be in the health sector. Please address this issue for the sake of posterity in the healthcare sector.